So what is torticollis? Did you know 3 out of 100 babies develop and suffer from this at birth, but it often only becomes obvious at 3 months? Let me show you how to diagnose it early and prevent it from happening to your baby. I'm Dr. Chris, MD, helping mums to be happy and raise healthy, happy babies. As a family physician, I've delivered more than 1,000 babies like yours, and I have coached tens of thousands of mums just like you with their newborns. So torticollis, or a wry neck, or a ring and wry is the same kind of word, a condition in which your child's head progressively and persistently tilts or twists to one side and he prefers to look over his shoulder instead of straight at you. Let's see what the word means. It's actually a condition in which the neck is twisted and the head is inclined to the one side, slightly up. It's caused by spasmodic contraction of the muscles of one side of the neck. From Latin word tort means twisted, plus column means neck, so we get torticollis. Can you prevent it, or what happens if you do not detect the early signs in your newborn or later? I show you exactly how you can detect it early in your baby and save a lot of suffering, therapy and even surgery when older. Let's be aware of this, mamas, or not if you want to deal with a big issue later. So, during the last 40 years as a doctor, I've seen it all. I've seen what an effort it is to try and correct a skewed neck that was not detected or treated immediately and then cause shortening and scarring of the neck muscles, which affects the baby's entire performance, its feeding, its movements, development, sleeping, sitting, and further milestone delays or disasters. I know how much you really want only the best for your baby, so lean in here and learn how you can be aware of this condition that occurs more often than you think, especially if you have maybe not even heard of this condition before. Now's the time to find out. Understand the congenital and acquired types. This will help you understand how to be aware or detect it easier and earlier. Okay? Benefits of knowing how this works gives you the edge on looking out for it and noticing it early and having a healthy, happy baby, which, as you know by now, is quite an intimidating task, because especially for those things you know not of or you don't know, and then you may even get blamed for it. So simply applying some easy posture principles could prevent torticollis, as well as improve the development and the strength and other milestones of your baby. So, okay, let's look into this a little deeper. Right, so, no, it's not contagious, this torticollis. It's not like picking it up in the queue at Walmart and it doesn't come overnight, okay? So make sure you know about torticollis and keep your eyes peeled, okay? Right, mamas, you may start to worry if your baby's head starts tilting to the one side, or if they favor all the time to look in one direction, or doesn't look up and down. You know, they have to look up and down properly, otherwise there's something wrong. Now your baby prefers to look over his shoulder at you like this instead of straight at you, or their eyes don't follow you because they require turning their head and their tight neck, so they only follow halfway and then they can't look that way. Okay, or they have trouble breastfeeding on the one side or prefers to feed on the other side only. Now your baby may also need effort to turn towards you and struggles to turn their head all the way, and becomes upset because the movement is hard for them to do. Or they might start getting a flat head on the one side from lying in one position all the time. Okay, this is called positional plagiocephaly, or flat head, and your doctor may even have noticed it at your baby's last checkup. So infant torticollis is called, is easily diagnosable by tightened head muscles on one side of the neck, which leaves your baby's head at a tilt and a rotation, or the chin slightly up. Now, torticollis in infants is quite common. 3 in every 100 babies gets this nowadays. Fortunately, in most cases, infant torticollis is easily treatable. So why does infant torticollis occur? Anything that shortens the muscles that connect the breastbone and the collarbone to the skull. Sternocleidomastoid muscle. Sternum is this flat little piece of the breast. Clavicle is like, it looks like a key or a collarbone, and the mastoid looks like a little breast of bone, a little lump behind the ear. So that's the sternocleidomastoid. When your baby has torticollis, this ropey muscle becomes shortened on the one side. Why does the muscle become shortened? Because your baby might have been cramped up in the womb, or may have been in an abnormal fetal position, such as a breech position, for a couple of months before birth, and that can put extra pressure on the side of the infant's head, which can cause the sternocleidomastoid muscle to tighten. Please subscribe and click like if you're getting value from this video, then YouTube will show it to more people. And it's important for them to know. Congenital torticollis develop in the womb before birth. That's why it's congenital, and acquired torticollis is a delayed effect, usually from something at birth, like an injury or infection thereafter. Not important to know, but just remember that they can be born with it or develop it from birth or at birth. Now, most babies that have torticollis were probably born with it. If that's the case, it's usually due to the way your baby was squashed for quite some time inside the womb. Remember, it's very cramped up inside there, especially in the last 3 months of pregnancy, the third trimester. So this muscle was shortened or tightened by some abnormal position, but injury during birth, bone abnormalities in the neck, positions of the spine, and in rare cases inherited disease can also cause damage to the nervous system or the muscles. If your doctor used forceps or a vacuum suction device during delivery, those also might have put a pinch on your baby's sternocleidomastoid muscle on the one side. More rare cases, infants develop torticollis after birth, but most cases can be traced back to the delivery. As doctors and midwives, we are very well trained to assist in delivering babies. We never pull on heads, before the baby is properly born. Even more so when it's out and the shoulders are still inside, when the head is outside. But realize sometimes during birth there may be fetal distress in the birth canal, and we only have seconds to get the baby out, or we lose them. Okay, so although a baby may have been born with torticollis, you may not notice anything until the baby is about 6 to 8 weeks old, because around this age most infants begin to move their neck readily, and they now gain more strength to control their head and neck, and now it becomes obvious. Before that, they're just laying there. Okay, because your baby's neck muscles by now shortened and contracted on the one side of the neck, it pulls the head asymmetrically into a tilt or a rotation, or often both. Now at this point you may begin to notice the following signs. Now, head tilts or turns to one side, poor and limiting range of motion in the head and the neck. Breastfed babies may prefer one side over the other. There could also be asymmetry of your baby's head and face, flattening on the one side of the head. Or the most commonly noticed symptom is this plagiocephaly, or a flat spot appearing behind the one ear or on the side of the child's head, or on the back, especially on the side that the child is favoring to look towards. A small soft lump in your baby's neck may also be noticed, or other musculoskeletal or muscle and skeleton problems may be present, such as a hip dysplasia where the hip socket don't develop properly, and also recurrent episodes of head tilting. So during these episodes your child may also experience drowsiness, irritability or vomiting. So why the treatment matters? If you can act early, you can help prevent any long-term problems for your baby. Without treatment, your baby might otherwise get complications, including less control of the head, or limited reach on the affected side and less tracking with the eyes because they have not as much head movement. A problem feeding, they can also be rolling onto the one side only, or they can do some crooked crawling, not in a straight line because their head's skew, or delays in sitting and walking, or poor balance. So how to treat infant torticollis? Now this exercise is especially useful for a baby with torticollis and a flat head. So, and it can actually help treat both these problems at once. Here's how you do it. Okay, so stretching exercises for torticollis are most effective if started when a baby is between 2 and 6 months of age. Now the principle to treat torticollis is to encourage your baby to turn the head in both directions. Okay, this helps loosen tight neck muscles and tighten the loose ones. So rest assured that babies can't hurt themselves by just turning their own heads on their own volition. Okay, so for detailed information on treating torticollis at home, or what to do and when to see a doctor or even a therapist, please watch my video on treatment of torticollis. That's another video that I made. Simply click on the video link on the screen or right now, or on the link in the description below, or please like and subscribe and ring the bell to be notified when I post more important videos. Okay, how are you enjoying your baby? Do you have any challenges? Comment below and I'll make more sure that I make more videos. If you need to know more things, just tell me what you would like to know about. This is Dr. Chris signing off. Ciao mamas, thank you for watching.